wish I had somebody that I could have asked this question to prior to getting those certifications. Ask yourself, why do you want the certification? Ask yourself, do you think it's going to help you in your business? And just note that we've had a lot of nurses who have had certifications end up in the Foot and Nail Institute because they have struggled in building their businesses. So just because you get certified doesn't mean you're going to be successful at it. Also, ask yourself, why does everybody push certifications? I think that when you understand that the certification indoctrination started back in probably mid-2000s, the reason for that was because at that point, a lot of our hospital systems were becoming magnet status, and that was an achievement that a lot of hospitals were striving for. And so one of the reasons and one of the things that they had to do to achieve magnet status was to have a certain percentage of nurses be certified within the hospital system. So we all were then taught and trained that we had to be certified to do anything out here in the hospital. And one of the things that you have to understand is that when you are a foot care nurse, you most likely are not going to be working in the hospital system. A lot of the nurses who have tried that didn't see much success there because what they did was the same thing that they do every day in the hospital system. They spread you thin, they overwork you, and you're not making any money because you're making the same amount of money that you're making as a nurse. As a foot care nurse business owner, that's a whole different landscape. And so one of the things that when I got my certification was that I was really kind of shocked, I guess would be the word I would use. When I got out here and started my business, nobody asked to see that foot care certification. Nobody cared. I would try to show it to people. I mean, look, I'm a certified foot care nurse. Look at me. And they didn't know what that meant. They didn't care about that. They were like, but can you cut my toenails? That's what they care about. That's it. And so I was just like, okay, so nobody's asking for this. Nobody cares about it. And I'm paying for it. And the only people who are benefiting it from are the powers that be that I'm paying to buy this thing from. And so I critically thought that through and was like, I didn't see the value in it. If you're going to be in the hospital working, most likely they're going to want you to be certified in this arena because you're working in the hospital and they want to check that box for magnet status. Other than that, most foot care nurses don't want to work in the hospital. We have had a lot of nurses come through the program in the Foot and Nail Institute, and they have one goal: to replace the income, to duplicate the income, to triple the income, and to get the hell out of the hospital. And that is what I teach. So if that is something that you're interested in, I would recommend checking out the Foot and Nail Institute informational webinar. It is free. You can either join it live when I do them. The dates are always listed on the Foot and Nail Institute.com website. If you can't attend that, you can also request a recorded version of that to learn more about becoming a foot care nurse. I am very transparent about these certifications. I know it does not make people happy. I know there are people who put their worth into these certifications. I get it. I had them. I let mine go. If I'm going to walk the walk and talk the talk, I'm walking it with you. And I am naked without a certification out here with a successful foot care business. And now I have taught nurses nationwide across this country how to do the same. And that is what I do in the Foot and Nail Institute. So if you want to be upset about that certification spiel that I give, I am sorry. That's not my burden to carry anymore, folks.